So starting with the perspective over time, a reminder for the one who were already involved, but also for the one who were not involved in that period, is that we need to look back to more than a decade, and that it took us, in fact, a decade to go from 2006 to the launch of the ERNs. And in 2006, we had the EURDES membership meeting. It started with conversations there between the patients themselves, the representatives, thinking how they have been started to organize clinics for their respective diseases in some hospitals with the clinicians, at the initiative of the clinicians or at the initiatives of the patient groups. It depends for which disease and which country. And then we aggregated that experience and exchanged about what do we need in terms of centers of expertise and their networking at the national and European level. That was further discussed in the European Conference for Rare Diseases and within the different national conferences organized by the national alliances with the stakeholders. So again, the clinicians, sometimes hospital managers, authorities in the ministries of health or research, industry, and other partners. From 2007 to 2010, there was a group called the High Level Group on Healthcare, which was established at the Commission level, and it was established by the member states. So it was a member states group. It was chaired by Alexandra Fourcade, the leader of the French National Plan on Rare Diseases, the second one at that time. And in the group, you had a representative, for instance, for the UK of Edmund Jesop, who was leading the commissioning services of highly specialized services in the NHS service. And this is where Matt was working at that time, for instance, Matt Johnson, or dear Matt Johnson, who after that brought that experience to you and to your audience. Through that period, there were experts like Ségolène Aimé from Orphanet or myself for your orders, and we constructed together some of the key concepts, which then later were taken into the elaboration on the directive on clinical on cross-border healthcare. In parallel, there were some funding, some project grants by the European Commission through the different public health program, successive ones in that period, which has helped to gain some experience, obviously, on networking of clinicians, either based on elaboration of good practice in diagnostic and care or around registries or a mix of that. And there were experience mostly from the public health project grants, some from the research grants. But from that, in fact, we learned a lot. I think we learned in terms of mindset more than practicalities, but it was not as instructive as we would have thought at that time. Then the directive on cross-border healthcare was adopted in 2011, and it took several years to get the implementing act. And I remind that episode because the directive on cross-border healthcare, there was a dialogue and consultation with stakeholders. So there was a capacity to influence some of the elements. For instance, to have an article dedicated to rare diseases into it, in addition to the one on ERNs and HTA, etc. But for the implementing act, there was no consultation. It's a member state process. It's a closed door exercise. And we were really able to keep the consistency of what was being developed only because, fortunately, some of the members in that group were people who were also members of the EU Committee on Expert on Rare Diseases and interacting with all of us. So they were able to push the system in the right direction, which is not always easy. I'm mentioning that because this implementing act, you have that now systematically on the HTA, for instance, at the moment we're struggling with that. We're going to have the same thing on the pharmaceutical review. Implementing act is always a nightmare. Then in that period, after that, after 2011, there was the EU Committee of Experts on Rare Diseases, and there was the support of joint actions, which has enabled us to really develop the concept of European French Network, to work with the representative member states, to work with you, the clinicians, to work with the patient groups, and to develop it. Particularly in some work packages, we're able, in some areas of work, we're able to develop the grouping, just that approach by therapeutic grouping, which has enabled to grasp on the 6,000 rare diseases all together, but propose a structure and propose a number of ERNs. Just to remind you, because I'm not sure you all know that, for instance, that in that period, before launching the call of the European Funds Network, what the Commission had in mind was to have maybe 10 ERNs, maybe 15, and they had the idea to have it per disease. So basically, we were on the road to have an ERN for hemophilia, one for leukemia, one for cystic fibrosis. You go on like that, and that's it. And all the others, just forget about it. So that, because the mindset, the spirit was to be competitive, not to be collaborative. And that are two key words. And we have changed that. And so I'm insisting on this introduction around that because it's you, the clinicians and the patient representatives, who are the owners of this concept and of this direction. The system of the European Union initially is not that. It's a competitive and limited number of networks. So we've changed, and all that has changed now, and it's being appropriated by the environment. But it's a long road. And after that, right before the launch of the ERNs, the Commission had several call for tenders, and you might know that Eurodes applied as the lead in a call for tender. First time we were doing that because tender means that you become a provider. It's not the same as when you submit a project. We did it, and it was Matt who led that work, and we associated with the Canadian Agency for Accreditation of Hospital, Accreditation Canada International, and with the European Association of Hospitals. And together we won the call, and the call has enabled us to develop the process to apply and with all the work on general criteria, specific criteria, all the application process, etc. So that was a fundamental work which has helped to shape and was completely coordinated informally, obviously, with the joint actions. So that's just to give you a sense on how we were able to shape the thing. And just to give you also maybe some hope that, yes, it's also complicated in your work today. We know that. And when the evaluations are coming in all together and it becomes very messy, we know it's difficult. We know it's difficult on the funding. We know it's difficult on many aspects, but it has never been simple. But we've been able to fix it or to try to go in the best possible direction at every step. So to give you that sense of hope that we can continue to progress in these directions if we are all well aligned and working together. And today we are where we are. We have 24 European funds networks, bringing together 400 hospitals, 1,600 healthcare providers, multidisciplinary, and probably, I don't know, I don't think we have a precise count on that, but probably around 16,000 doctors and clinicians involved in that. That's the critical mass, and that critical mass here, quantity means a qualitative leap for all of us, for the patients surely, but also for the knowledge, for the capacity of the clinicians, and for the career development, for the attractiveness of the sector. And that has enabled us really to make substantial progress on improving management of rare disease, research, workforce development, and timely access to cross-border healthcare. Now, not surprisingly, the European Funds Network were mentioned 75 times in the RARE 2030 final recommendations as the key structure to optimize rare disease evidence generation, accelerate diagnosis, improve access to specialized healthcare, building the capacities of national health systems, and embody patient partnership, and contributing to make Europe a world leader in the development of rare disease therapies. This has then been taken into the project, the priority, the advocacy priority on the European Action Plan for Rare Diseases, where obviously the European Funds Network are central. I wouldn't say are the main central, they are central, but there is other elements which are very important. Funding on research on excellence in general, and not always clinical research. We need also the basic excellence in research. The regulatory framework is important, but also the holistic approach and in order to reach the well-being and the full integration in society. But the ERNs in this future European Action Plan are also a flagship in itself. And for that reason, they were core in the messaging of the 3 European conference of the EU presidencies in France last year. You remember what is this day in February, Czech Republic in October, expert conference last year, and Spain recently in Bilbao, when Spain organized it with the European Committee of Social and Economic, the European Economic and Social Committee. You are well aware of the call from the 22 member states. In the different chapters, there was one dedicated to ERNs, so it's strong there too. And overall, ERNs are in the cross-border healthcare directive. This cross-border healthcare directive will continue to be evaluated by the member states, by the Court of Auditors, etc. So ERNs will not go away. And as Alberto Pereira from Endo ERN said it in Bilbao, ERNs are here to stay. So with that, I think I can now move to the celebration, just to take stock of what is going well from our perspective, what is really progressing. Since 2016, which is only 5 years, ERNs have made significant progress in all core activities areas, and we can all be proud of it. First, I would start with education and training. This area is possibly the one area where we can, where there was the greater number of activities which have been organized since the launch of the networks. Today, if we are correct, all ERNs have a regular education and training programs for clinicians. Through the year, they organize webinars, courses, short-term exchange program, etc. So just to mention 2 examples, for instance, the ERKNet, so for kidney diseases, postgraduate curriculum has introduced a 3-year postgraduate curriculum based on clinical training, webinars, and e-learning, which provides state-of-the-art education on the entire spectrum of rare kidney diseases. Those who successfully complete the course will be recognized as European rare kidney disease specialists. That's a milestone. That's important. If we have that in different areas tomorrow, that really is a game changer. On the Euro NMD, second example, on neuropathies, has organized Rehabilitation Summer School in 2023. It's an event designed for experts on different disciplines: physiotherapists, occupational therapists, clinicians with an interest in neuromuscular diseases, clinicians specialized in rehabilitation medicines, patient advocacy groups. And the primary objective of this summer school is to disseminate knowledge about the current and the future modalities of rehabilitation in rare, complex neuropathies. So just to give 2 examples, but of this huge development that we can really consider as a great progress in itself, thanks to that structure. So education and training. Second area, the care. As always, we'll start with the cross-border virtual expert panel advice. ERN have discussed and provided virtual EU cross-border consultation on diagnostic, on treatments, and on disease management for more than 3,450 cases. Great. In itself, it's great. It's a learning curve, and we can build on that. Now, clearly, that needs to be scaled up. It needs to be organized at the national level first, but also more at the European level. And we can hope that with the new joint action, as there is a work on the financing of that between the member states, there is hope that we could be able then to scale it up, because it's certainly linked, obviously, one of the bottlenecks is the funding. The second area in care to mention is the patient journeys. Patient journeys are possibly one of the most popular tools used in the ERNs to engage in discussion around the standards of care and the patient needs. These journeys illustrate the needs of people living with rare and complex conditions throughout the care pathways, and as such, can be used in many ways. Example, in 2022, Ernica ERN developed a patient journey where it considered to be an umbrella concept under which Ernica activities sit. So really using it in a strategic and transformational way. AP Care ERN has used them as a basis to develop standards of care for patients with rare and complex epilepsy. So that I would consider as one of the key elements with the education. We now have such journey being developed at I mentioned EpiCare ERN, ERN Cranio, Endo ERN, ERK Net ERN, Genturist, Ithaca, ERN Lung, ERN Rita, ERN R&D. So really many ERNs, not all yet. A recent example, the metachromatic leukodystrophy MLD eligibility treatment panel. So here, all ERNs experts provide virtual advice for clinicians through an online platform that allows ERN experts to share information and to connect to discuss complex cases. And on the top of this service, they are using the same IT system. So ERN R&D is collaborating with the MLD initiative, so the metachromatic leukodystrophy initiative, to help clinicians with difficult treatment decisions for this metachromatic leukodystrophy patients via a structured discussion process. So interesting new approach of virtual consultation here within one ERN, which could be used by other ERNs. In the care, I would not like to close that without mentioning the early response to COVID-19 for the vaccine recommendation. You can be proud, all of you, and particularly the clinicians, that as early as the 23rd of March 2020, the 24 ERNs were able to pool their collective expert and knowledge and publish their expert opinion on the priorities and contraindication of vaccinations for adult patients with rare diseases that fall under the scope of each network. And that really showed in this context of emergency the benefit of having ERNs. Third area of achievements, the networking. Cross-border ERN collaboration is moving on very well. There is priority to address the multisystemic needs of most rare diseases. We have, for instance, the working group of spina bifida with experts from Eurogen and Ithaca. It's a good example of a stable collaboration across ERNs that started in 2022. Also, we have the 3 neuro ERNs, so R&D, NMD, and EpiCare, established in 21, 9 working groups to collaborate on cross-cutting issues such as joint training curriculum, next generation sequencing applied to diagnostic, gene therapy policies, registries, approaches to mitochondrial diseases, that's an important one too, and amongst others. So just to give you these examples on the networking. Another area of networking, the multidisciplinary networking. During the first 5 years, ERN's networking activities primarily involved specialists from the same disciplines. That's logic, renal, eye, genesis, neurologist. But recently, Euro NMD launched a new cross-cutting specialized group initiating multidisciplinary networking. And the focus of this working group is to promote, standardize, and validate multidisciplinary management and care of neuromuscular diseases. The specialty group is open to all professions involved in the management and care of the NMD and aim to develop activities to cover the following areas: rehabilitation, so it goes with the previous example, physical and occupational therapy, speech therapy, oral therapy, dietetics, nursing, psychosocial aspects, social work, cognitive assessment and management, and palliative care. And really, from the perspective of you others, and can tell you really from the patients across Europe, that's really what they expect to see more and more in ERNs, to have that holistic approach, to have a more integrated medical and social care, absolutely essential for the journey of the patients. The fourth area of achievements is the knowledge sharing, with major achievement, obviously, the clinical practice guidelines and clinical decision support tools. Over the last 6 years, the networks have developed, as well as appraised and endorsed, more than 400 clinical practice guidelines. I know that some of them were only an endorsement and not a new development, but still, it's huge. 400 guidelines adopted, that's a major change. So we can imagine when we project at 5 years from now. And I've produced other valuable resources in all EU languages for people living with rare and complex conditions, such as statement on do's and don't do's, etc. An interesting progress is to see that before when the ERNs were meeting, it was mostly for management of the network, but now it's more and more scientific content. It is gradually taking the role of a scientific congress for each ERNs. For example, this year, ERN Reconet used this annual meeting to organize a scientific congress on rare and low prevalence cognitive tissues diseases, covering topics such as epidemiology, diagnostic, clinical management, biobanking, and registries. So that's an interesting evolution, obviously, that goes in parallel with the education, I would say. 5 and last area of achievement, the research and registries. All 24 ERNs received a small grant from the Commission to start developing their registries. They are all at different stages of development. More than 50,000 patients with rare disease are currently followed in these registries, with an expected 5-fold increase in the number of patients over the next 3 years. A success story, for instance, is eRKNet registry, which provides demographic information, facilitate collaborative clinical research, identify cohorts of patients with rare kidney diseases across Europe. And moreover, the registry captures clinical performance data and allows benchmark performance across the ERN specialist. Now, as interesting as that can be, I'm almost to cry when I read that there is only 50,000 patients involved in these registries, and we have 20 million patients in Europe. So obviously, these registries are not intended for all the 20 million, but for probably the more severe forms of diseases through the ERNs. But even if we multiply that by 5, we obviously need the development of registries through other schemes, either from the research or from the public-private partnership. Last, in research, ERICA's repository on rare disease patients-reported outcome measures, that's really great. It's a good outcome of ERICA. There is in this repository 1,080 measures, including 444 measures specifically developed for rare diseases. So that's important. It's important to know that it exists. It's important to use it in your respective work because they are prompts validated and they are extremely useful. The repository allows to search this prompt by type of measures, by ERN, by group of diseases, by function affected, and by ORFA code and by age. So that's great. So overall, really, the key achievement that I can highlight is this education and the scientific congress, the cross-border virtual panel, and the new initiatives on virtual panel within the ERNs, the patient journey and the clinical guidelines, and some progress on the registries. Now, more briefly, to conclude on looking ahead. So today, our guest speakers will share with you some of the lessons learned from the 5-year evaluation reports. Once the outcome of this evaluation will be published and available to all of us, I hope that we will take stock and reflect on the actions needed to improve and consolidate the ERNs. So not to park it as an administrative exercise, but really to make the most of the outcome of this evaluation. As we wait for the final report to be published, we have already identified, obviously, some areas of improvement. They were already outlined in the joint letter that we addressed, Eurodis and the leaders of the ERNs, to the European Commission, to the heads of member states, and to the European Parliament last month, just before the conference in Bilbao. So 6 areas highlighted in that letter and to you today, which sounds to us quite obvious. 2 of them, I would say, are battle to be won, and 3 are ongoing, and the last is more an internal challenge. 1, it's monitoring the patient experience and the health outcomes. By collecting and monitoring the experience-based and outcome measures to improve people experience with specialized healthcare and to assess the impact of ERN on patient outcome. That is essential. But that is still a battle to be won, and to make sure that it is with a vision of addressing the needs of the 20 million patients, not just the one coming to the healthcare providers of the ERNs. Second, strengthening the research capacities of the ERNs, their clinical research readiness, and their role in the rare disease research ecosystem through the rare disease partnership, so RDERA now, and also through the public-private collaborations. 3, and that is ongoing. I think we'll all consider it's ongoing, and the new RDERA, which has still to be approved, evaluated and approved, we hope, then we'll be on track. Again, we don't have sufficient resource for the clinical research network, we consider, but let's hope that we do good work in the first 3 years to be able to scale it up in the next 4 years. Third priority, expanding the disease coverage of DRNs. That's very important, but while ensuring good quality assurance in this process as the network expands their scope. That's obviously the dynamic which is ongoing. Fourth area, streamlining the European care pathways, essential. And that's still a battle to be won. Not easy, including the recognition of a formal role for ERNs in EU cross-border healthcare decision-making and the implementation of ERN knowledge assets, such as the clinical practice guidelines in these pathways. And that's, we obviously have the joint action here to help us to progress with some elements of it, but it will still be other parts of work to gain particularly the recognitions of the standards of care defined by ERNs as almost opposable, if possible, but also a more formal role on the cross-border healthcare. And we don't need a new regulation for that. We just need the political will and the right administrative support from the Commission in particular, and of the member states, obviously. Fifth, to fully integrate the ERNs into the national healthcare systems through allocating adequate human and financial resources to implement and use the recommendations and resources that will stem from the joint action on integration of ERNs called JARDIN, the acronym. So that is starting, that is for 3 years. It's well designed, I believe, so should be able to deliver. And I mentioned other area of work of the joint action that has impact in other areas. And sixth and last of the priorities, supporting the volunteer contributions through the recognition of the vital role of patient organization representatives, healthcare providers, and clinicians in ERNs, and addressing the challenges in recruitment and retention. Attraction of young clinicians, doctors, future champions in the area of rare diseases is a challenge that we certainly need to address. You're all well aware that the issue of workforce in healthcare becomes progressively the issue number 1 in the mindset of the European Commission and top officials in health at national level. So we need to be mindful of that. We're going to have a lot of pressure around in terms of orientations of the limited resources, let's say, of new doctors. So to conclude, we have to seize this moment to consolidate the network and infrastructure and deliver our health policy recommendations across all relevant areas: diagnostic, healthcare, research, therapy development, and integrated care. While the Commission and the Member States do have a responsibility, this innovative structure to make it sustainable and integrated into the national and EU health system, us do have the responsibility to be clear about how the ERNs can meet some of the most pressing needs of our communities. For clinicians and patient representatives involved in the ERNs in the next 5-year cycle, we are now starting, it's now at the start of the moment to scale up some of the core activities, to strengthen the structure, to continue highlighting innovation and best practice, and partnering with decision makers at European and national level, so that the structure sustain and are reaching its full potential. We need to build on what works, on these achievements that we have identified, that there is others that you may identify in today or in the coming semester. And I would add that we need to clear a clear compass in what we do, a compass on health and social outcome as being really what we want to achieve. This at the end, what needs to be measured. So that's the number 1 in our 6 element mentioned. 2, excellence in care, excellence in what we do. 3, knowledge generation. 4, knowledge implementation and sharing. And 5, leaving no one behind, which is at the core of the concept of this overall approach, and in terms of disease coverage, geographic coverage, and cross-border healthcare. So I wish you, with that, an excellent day of discussion and meeting. Your continued leadership and constant dedication to your end is essential, is highly recognized by your orders, by the board of your orders, by all the members of your orders, really. We know what we owe you, and I'm often saying that this system works thanks to heroes, but we need to make it sustainable, because we cannot bet that there will always be heroes to continue the great work that you're doing. I wish you a productive meeting. Thank you.